record button. So for tonight's session, I am really excited to be able to introduce to you Kelly Fry. She is a family therapist at Caron. I have had the pleasure of working with Kelly when I first started or shortly after I first started at Caron about 16 years ago. So I know that you will be extremely pleased with the presentation that Kelly has for us tonight, and she can share a little bit more about her journey and her pathway into family therapy at Caron. So I'm not going to spend too much time. At the end, I just do ask that everyone, I'll be posting an evaluation in the chat. So please, please take a second just to fill that out. That's very helpful for us just to make sure that we're planning the topics that are of most interest to all of you. And the last thing that I'll say before I turn it over, just slipped through my mind. So I think without further ado, I will turn it over to Kelly.
Thank you, Corey. So before I share my screen, I just want to do a quick introduction. Like Corey said, my name is Kelly Fry. I'm a family therapist. I've been with Caron for a little over 14 years. My journey began with student assistance, and I earned my master's in mental health counseling, became a licensed professional counselor, certified alcohol and drug counselor, and I then became a addictions counselor, working with our young adult males and young adult females. And then for the last 8 years, I've been working as a family therapist. So I've worked with anyone from adolescent all the way up to our older adult population, and currently I'm working with a lot of people in our men's continuum. So I have really enjoyed working with families and patients alike. You know, my heart is sad because, you know, we aren't welcoming families to our campus like we once did. And so, you know, I've really grown to enjoy these kinds of presentations because it is a piece of what we can do as far as offering support, education. And I want you to know, like, I really value your time and your attention. And I trust that, you know, you find this information helpful. Two ways of asking questions. You can use the chat. I have it up next to me. If there's questions that come up, feel free to just type it in the chat. I will address them as they come up. If perhaps, like, I know the content is going to come later down, I may overlook the question, at least initially, knowing that we will be getting to that information. So hopefully you'll find this helpful, and hang tight for 1 minute while I get our presentation up. All right, can someone pop in the chat real quick and just let me know that you see Solutions for Families on your screen? Perfect, great. So this is identified as Solutions for Families. We want to look at the impact of substance use disorder and looking at your road to recovery. Our clients, our patients, you know, your loved ones, they are really working hard towards finding their pathway to recovery. And they are doing their journey, and we and you as loved ones, you need to find your own journey to recovery. And so this presentation is really going to focus on the impact it's had on you and what that pathway towards recovery looks like for you. So you may or may not have heard this quote before, but this comes from the big book, the Alcoholics Anonymous Big Book. And it says this. This comes from page 82. If you want to see the full context, or you want to read it in its entirety, you know, feel free to either Google that or look in your copy of the big book, and you will see its entire content there. So, but the quote says this: "The alcoholic is like a tornado roaring his way through the lives of others. Hearts are broken, sweet relationships are dead, affections have been uprooted, selfish and inconsiderate habits have kept the home in turmoil. We feel a man isn't thinking when he says that sobriety is enough. He is like the farmer who came up out of a cyclone cellar to find his home ruined. To his wife, he remarked, 'Don't see anything the matter here, Ma. Ain't it grand the wind stopped blowing?' Yes, there is a long period of reconstruction ahead." And this quote, I think, is very impactful and meaningful. I think, obviously, because it gives us a great visualization. You know, we recognize what that may look like or what we may experience it as. But when you put it in perspective of what it has been like for you as a family member, especially if your loved one is in recovery, it's pretty amazing, yes, that they're no longer actively using, right? Or maybe things have calmed down. But just the idea of abstinence or early recovery alone does not take in consideration all of the things that have been impacted in the pathway of that cyclone, if you will. So, yes, there is a long period of reconstruction ahead. But thankfully, knowing that this disease is a treatable one gives us that hope that there is reconstruction ahead. So we really want to look at how we can assess the ways that you have been impacted by your loved one's substance use disorder, understand the ways that you may have reacted to their behaviors, and looking at how you can recover from this crisis. These are not likely to have been a once and done crises. These are typically crisis upon crisis upon crisis, some big C crises and some small C crises. But knowing that this has been, for a lot of you, been going on for a long period of time. And I think it bears mentioning at this stage of the presentation is that for some of you, this has been going on for as long as you can remember. This may be your child, this may be your partner, but that may not be the first person in your life that has suffered from this disease. And so having a history of the impact of substance use disorder may reign true for some, if not a lot of you. So the question, how have you been impacted? We could probably put on a few more categories, but I believe these are some of the most significant ones. The first one, we'll look at and we'll give you some examples of them. And obviously I'll provide some opportunity to kind of process through if you so wish. But we're gonna look at the way you've been impacted financially, socially, emotionally, physically, and spiritually. So let's start with the financial impact. Feel free to, at the end of it, take yourself off mute and add, a comment or two, or if you wish to use the chat, you can do that as well. That's true for any of these slides. So you may consider, lost or stolen valuables. Maybe something of value was misplaced, maybe it was sold, maybe it was traded. Things that were valuable to you and or your family may have been stolen in order to trade or to buy or to sell for substances, right? And so, some of these things are not replaceable. We hear of heirlooms, jewelry, different things of significant value that you can't just go back to Walmart to get like a new TV, for example, or a new car or whatever it may have been. There may have been some things that have been lost to you that were really irreplaceable. We can consider travel costs, right? That may be, travel, to see if they're okay. Maybe your loved one lives in a different state as you do, and you have found yourself in a car, on a plane, on a train, whatever it may be, to kind of get some stability or get some peace of mind or whatever it may be. It could be even traveling to good things like, meetings or treatment or therapy, whatever. And so missed work has a significant financial impact, right? If you're not going to work, maybe you've taken your PTO, or maybe you don't get PTO, or maybe you've used all your PTO. So when you don't work, you don't get paid. And this may be even in a significant issue if your loved one is also contributed to the family finances and they're unable to work. We may have unpaid or late bills. Maybe that was normally your loved one's responsibility and they haven't been doing so. Or maybe just because of the amount of money they're using or they're not being responsible, what have you, there's not adequate income to cover the expenses. Impulsive buying. We recognize that, what they call is an addiction interactive disorder. Like there are other interactive addictive behaviors that might come along with substance use, gambling, shopping, things like compulsive of that nature, and then impulsive buying. And that might be a detriment to the financial impact of you and your family. Careless financial decisions. We hear of stories where people are buying houses, buying cars, making decisions of, cashing in certain kinds of accounts or, different things that maybe wouldn't normally have done unless they were under the influence or in a what they perceive a difficult state of mind. Medical bills can really add up. We recognize that there can be a lot of medical expenses related to someone who has substance use disorder, whether it's from accidents, whether from overdoses, whether from medical issues that were either caused or exacerbated because of one's use. And let's put it out there, let's be honest, the cost of treatment. And for some, yes, insurance can cover for some treatments. Some is out of pocket. some even with insurance, there's still a significant deductible, right? And for a lot of people, they may not get the recovery concept or the way of life on their first time. So they're going to treatment upon treatment upon treatment. So recognizing and putting it out there that the cost of treatment can be very significant. So I'm going to continue on, but if you have any comments or questions, feel free to put them out there. I'll pause real quick at the end of each slide. If you have any questions or comments, feel free to chime in. All right, social impact. This is a big one. This is sometimes maybe we don't even see it as we're going through an experience, but realizing you may have lost some friends. It may be due to them withdrawing. It may be more likely that you're the one withdrawing. You may ask yourself, like, how many more dinners can I sit through? Them asking how my child is doing, how my loved one is doing. Am I really willing to go to another friend get together without my partner? Whatever it may be, a loss of friends can be pretty significant. Or I think there are some well-intentioned friends that just don't understand this disease and they don't know how to support, right? They may say things or do things that are really not helpful. Family conflict, right? Maybe you're used to spending a lot of time with your family, but as we'll look later on in part of this presentation is there's differing ways of responding to this disease. And that can create a lot of family conflict, which, some of the things like the holidays or the weekend activities or, the weekly dinners, those things may have gone a wayside. Estrangement, whether from, neighbors or friends or people that at one point had a significant place in your life. Infidelity, right? This disease causes one to go against their own morals and values. It creates a discrepancy in holding to one's morals and values. A loss of trust, right? Not being able to trust, not being able to take someone at their word. And because when they're active in their use and they're not and they're acting in their true self, they are not in a place where they are trustworthy. Their lips are moving, but you're not trusting what they're saying. The idea of trust being lost in buckets and being gained back in drops. And so, trust is not rebuilt very quickly. And even if there is a perception or if there is an idea that maybe or something that's suspicious, whatever trust may have been rebuilt is gone once again. Humiliation, maybe your loved one is someone who has done some things that are really humiliating, maybe ways in which they presented themselves in public. Maybe it's been at a family function, a wedding. Maybe they're ones who wander around outside or, they're at the jail once again. We hear a lot of people share about living in a small community where everyone knows everyone, or maybe you yourself or someone in your family has a job or a position that's very visible to the public. And, we hear of stories where people's names are published in the newspaper. There's so many ways in which humiliation can be a part of the social impact. And just neglect, like not being able to foster relationships, not knowing where those people may be, unless you are one who has found, what a lot of you may have found is a community in 12-step recovery or in the parent and family support meetings. Those are great ways to do that, but that's sometimes not our first initial reaction in regards to social. Emotional, there is a significant amount of impact emotionally. The irritability, a sense of dread, like, here we go again. Like, waking up and there's that heaviness on your chest, not knowing what the day is going to hold. The day could be perfectly fine, maybe not chaotic, but just that sense of dread, almost that looming, that gray cloud. And just kind of like waiting for the other shoe to drop. Feelings of despair, like how in the world can we keep on going? Can I live with this fear and this worry and this suspense of what may or may not happen? Is this even possible? Blaming oneself, blaming the person who has this disease, blaming their chronic pain, blaming the drug dealer, blaming their trauma, blaming their mental health, blaming that doctor who prescribed them that medication, blamed that person who, ended a relationship with your loved one. We could go on and on, that blame. And that is a hard emotion to sit with, right? Embarrassment, let's be honest. There are some things that happen in response to this disease that really creates that feeling of embarrassment, and especially when your loved one is showing up in a way that's contrary to who they are as a person, it can, I think, kind of exasperate that feeling. Feelings of anger and resentment. Anger is a secondary emotion. And what I mean by that is something else is underlying that. It could be, anything from sadness to frustration to disappointment to hurt, whatever it might be, but then holding those things and they're turning into resentment. And resentments keep us stuck. And, it may be resentments against the person and maybe what they've done under the influence. It may be a resentment towards, that this is even a part of our lives. This is something that we did not ask for. This is not something that we wish it was a part of our life. This is not something that we feel like we deserve, but yet here it is. Feelings of guilt and shame. And those are very heavy emotions. Just one of them alone is pretty heavy, let alone the combination of them. And just the impact of the emotional, like being victimized. Like there is very likely scenarios in which you all could share and, realize that this has been a very difficult process. And for some of you, you've been dealing with this for a very long period of time. There may be some of you who have maybe had shorter, more intense experiences. And some of you have been dealing with this for, chronically for a longer period of time. Physically, right? Physical impact. We've got insomnia, like, not either being able to go to sleep at all or whether to, fall asleep and not being able to stay asleep. Or, being so exhausted, you take a long afternoon nap or an early evening nap because you cannot put one more foot in front of the other and then not being able to sleep at night, and having difficulty in that way. A sedentary lifestyle. When life is overwhelming, it is a typical response to have a very sedentary lifestyle. So maybe there was things that you were doing beforehand that you're no longer doing. You're no longer going for walks. You're not going out with friends. You're not doing things like bike riding or walking the dog or things that were pretty typical. Maybe some of you who have felt that you wanted to stay close in case something happened. You wanted to be there in case they came home or whatever it may be. And stress. You have listened to news, you've read articles, your doctor has talked to you all about stress. Stress is a huge contributing factor to medical issues, right? And so a lot of things, they push back on stress, which leads us to the next one, health issues. Some of you may have already had medical issues that predated your family being with a substance use disorder. However, often this stress that's related to this is a contributing factor to a lot of medical issues. And if you already have them, it's going to exacerbate them. Mental health issues, right? Anxiety, depression, worry, anxiety attacks, PTSD, post-traumatic stress disorder, having seen things, having noticed things, we hear of people, and some of you may relate to this, who have had to Narcan their loved one, who have had to resuscitate their loved one, who have seen, tragic accidents, who are not even sure if their loved one is going to be alive. There's a lot of potential, tragedy that, really elicits that post-traumatic stress response. And, a lot of people are, and let alone all of those things happening. And then you add on things like, the pandemic for the past 18 months, adding to what was already maybe difficult, creating these issues that are even more difficult. We talk about like maybe weight gain or weight loss, or maybe like kind of like a yo-yo, back and forth, not being able to maintain a healthy weight. And and that leads to the malnutrition. When you're stressed, when you're overwhelmed, when you're having difficulty, with life, you're not choosing foods that are maybe of health or nutrition or of value to you. So not having the nutrition that you and your body need. And fatigue, like a general sense of malaise, like you are not feeling, there's no energy, there's no gumption to get up and go. Spiritual impact, okay? A disconnection with self and others, not knowing maybe who you are, who am I? Yes, I know my name, right? I know where I live, but what do I enjoy? What makes me happy? What do I bring to a relationship? Not even being able to see kind of beyond oneself. A loss of faith. If you have a faith in a higher power, or, someone that's bigger and greater than you, just kind of a loss of faith. Like if this deity, this person, this higher power were real, would this really be happening? Not trying to, be able to understand and try to bring the two together. a sense of loneliness. This disease isolates on both sides, right? Whether you are the loved one or you are the person who has this disease isolates and it thrives in isolation, right? When it's in isolation, it grows and it grows and it grows. If you're not getting support, you're going to feel isolated. Your loved one, if they're not getting support, they're feeling isolated too. I'm grateful that you guys are having this opportunity to join together. So this is your first presentation. No, like you look across the top of your screen there, you're seeing all those faces. There is that many people and thousands more who understand where you're coming from. Finding that community in 12-step and parent and family support meetings and other recovery related support groups. There are other people who get where you're coming from, and that helps to alleviate the isolation. Unmet expectations. This is not what I set out to do in my life. I don't deserve that. And I put that in air quotes. Like, that expectation we had for the life that we planned for, that we worked hard for, that, we did what we thought was best and not having the expectations met on the other end. A loss of moral integrity. There's a very good chance that you even may have done things that went against your morals and values. That could include things like, lying to other people or lying on behalf of your loved one. It may include things like, lying to your own boss. It could be maybe you are bargaining, maybe you're snooping, maybe you're doing things that just like, they don't really feel good, but almost feel like you don't have a choice. I saw the line, the stealing, there might've been things that you may have done or that your loved ones may have done that really go against the moral compass that is set for you and your family. A change of values kind of feeds into those other ones. A sense of hopelessness. Spirituality typically gives us a sense of otherness. It gives us a sense of connectedness. It gives us a sense of love. And when we're not experiencing those things, it can really bring a sense of hopelessness. Like if our spirituality can't bring that to us, where are we supposed to find this? So the next section we're going to look into, before I go any further, I want to give opportunity for any questions in regards to the impact. Any thoughts, any comments, any questions? All right, so we're going to look at how do we react, okay? So recognizing that each family member is going to react in a different way. There is no right, there is no wrong, and we're not even going to say that every family member is going to act the exact same way all the time, right? You may have like your go-to reaction, or you may have ones that you kind of go from this one to this one, or if I'm in this space, it's this one, or if it's this situation, it's this. The bottom line is recognizing that all relationships are impacted, okay? So here are some of the common reactions of family members. And as you go through this, you might say, oh, yep, that one's me. That one's me. Okay, I didn't do that, or I didn't do that one yet. And some of you might be like, this is all of them, right? Oh my gosh, like I've experienced every single one of those all the time. So you might be the confronter, or you're thinking, well, I'm not the confronter, but this person's a confronter. Yeah, the confronter. And so this is someone who sees the evidence, they see the behavior, they see what they see, and they're willing to confront it. That's their thing. They are the confronter. Now, what we do know about the confronting is it doesn't often have the impact we're hoping it does, which we'll kind of address that a little bit later. But the idea is that there is usually a confronter in a family system, okay? The investigator. It's not a funny joke, but I think it's very, very true, is that there is the investigators, people like who can find the stuff. I would dare say, I would put a family member, whether it's a spouse, a child, a partner, a parent of someone who has this disease, they could probably give the FBI a few tips, right? I think it's very, very true. It's very, very valid. You all know the spots. You know what to find. You know what you're looking for. There is no secrets. The places you have likely found things, you're like, you're not surprised anymore. Maybe at one point in time, you're like, really? In the suitcase, in the attic, in that little like place behind the fireplace? Yeah, all the places, right? We have our avoiders, so you're like, yep, that's me. Kind of you envision the ostrich in the sand, right? The head in the sand. And it's like, if I don't see it, it can't be true. Because if I acknowledge that it's true, I have to do something about it, and it's way too painful. And I want to acknowledge these without bringing any elements of shame and blame to them. Recognizing that these are the natural, normal reactions to people who are doing things because someone they love is not safe from harm. So if you are an avoider, recognize that that behavior, it is protecting you in some way. And so, it's almost having an appreciation and a gratitude for that service that your brain essentially is doing for you. And then recognizing at some point it's no longer doing its purpose. It's not protecting me. It's contributing to this disease, which we'll talk about a little bit later. The controller, right? Someone who says, okay, if I can control this, somehow we can make it go away. It won't be as bad. It won't progress. And unfortunately, right, there is this element that sometimes it seems like it's working, right? Some of your control attempts appear as if things are, maybe stunted or maybe not as bad as, but what we know is that it's not long lasting, right? But it negatively reinforces a behavior that's not really effective. Worrying. Some people are natural worriers. Some people have that as like a full-time job, like that's their thing. And I can't just say it's just as parents. I think there's a natural inclination for people who are in a parental role to worry, because there's that, like, are they safe? Are they okay? Are they happy? Are they healthy? Are they eating? There's all of those those maternal, paternal instincts that are naturally given, no matter how your child came to you. Those caretaking roles. And this is where we'll talk more about in the future slides about some enabling and things like that. But recognizing caretaking as a partner, as a parent, as a loved one, as a friend, that's not a bad thing to do, right? But what we do know is the disease of substance use disorder distorts these behaviors that can be good and distorts them to something that's actually not helpful. And then that brings us to the enabling. I did see a couple of questions. So I want to address those real quick. So the question I see is, do these impacts continue years after sobriety? They can, because this is the thing. If a family is also not willing to engage in a program of recovery, they still may do these things, right? There's opportunity to do many of these things, even if your loved one gets well. So when we work with patients on our campus, for example, we let them know that you can get well even if your family stays sick. And I'll say the same thing to you. You all as loved ones, you guys can get well even if your loved one stays in active substance use disorder. Now, will it be easier? Will it be more opportune if both of you are doing it simultaneously? Of course. And that's the hope, right? But recognizing that your well-being is not contingent upon another person's well-being. That's what we do know for sure. And so a lot of these behaviors, if you all don't have things to make change, I see the comment, working Al-Anon has really helped. Absolutely. Al-Anon, although, it is the sister parent, partner child side program to AA, any family system who has gone through any kind of difficulty or challenges or emotionally unavailable, who didn't really have emotional intelligence, didn't really learn how to work through problems, didn't learn how to address the elephant in their room. Every person, I personally believe that every person can benefit from going through an Al-Anon type program. You've got Al-Anon, Families Anonymous, Codependence Anonymous, Nar-Anon. There's all these different programs. It doesn't matter which one you do. You find the right one that fits you. You find your people. If you go to a meeting and it's not the right kind of people, well, don't keep going to that meeting. Find a different one. It's like a restaurant, right? You go to a restaurant, you don't like the food. Well, don't go back and expect it to taste better next week. It's probably not going to. Go to the one next door and try that one. If that one tastes better, well, then keep going back to that one, right? And so you're going to need to find one that has people that are similar to you, in the sense that, can you relate to their stories? Are there people in those meetings that have what you want? And if they do, then you're going to listen to what they have to say to you, right? So if you are a parent and you show up with a meeting with all spouses, you may gain some insight. I'm not going to say you won't, but you will gain a better, more able to adapt to what they're trying to tell you if it's also another group of other parents, right? And vice versa. And so, because it's a different kind of relationship. So find the kind of group that has people that are similar to you, that you have opportunity to get what they have, right? If they have what we want, we're going to be willing to do what they're telling us to do. So it brings us to the big E word, right? Enabling. This is often where we're like, I don't really want to talk about this because, it has really kind of had this like negative stigma about it. And I think that's kind of, it is unfair. It's not a little unfair. It is unfair to people, because that last line you can see on the slide, it says enabling is done out of love. Love is why we enable, okay? If we did not love, we wouldn't enable. If it was a stranger, we could still be kind, but we're not going to enable them. Someone you love is not safe from harm. But what happens, unfortunately, is with substance use disorder, it distorts that act of love. So what you may do for another person, if they don't have this disease, it's simply an act of love. Doing that same behavior, that same action, that same gift, that same good deed, if you will, to someone who has this disease, it's going to have a negative impact. So, but the definition that, we kind of go with in regards to enabling is doing something for someone else when they can and should be doing it for themselves. Okay. So if you're like, okay, what's enabling? What's not enabling? I'm not really sure. Ask yourself, like, given their age, their experience, their capabilities, it doesn't mean that they've done it before, but are they capable? And unless there are some extenuating circumstances, the answer can be like, wow, a lot of things I've been doing, they are capable and able to do for their own self. So that can kind of be something that will give you kind of a sense or a pulse on whether the things you're doing are enabling or not. Recognizing it as a natural and normal response to an abnormal situation. When someone you love is not safe from harm, enabling is the thing that we go to. Nobody has to be taught how to enable. We have to be taught what we're going to learn about tonight is to not enable. That's what we have to be taught because it's counterintuitive. What you've been doing thus far is intuitive, it's natural, it's normal, it's what's to be expected. It's what everyone does, which is why most people relate to it until they learn otherwise. Once we know better, we're going to show up differently. So recognizing that, I like this third bullet a lot. Enabling can be used to get a relief from a terrible situation. By enabling, you yourself might get some relief from the painful emotions you're experiencing. Okay. But bottom line is this: enabling is done out of love. Okay. Yeah. And I see the comment about the parent support meeting and recognizing that the communities that are bonded together out of horrific situations have such a unique way of building these relationships that surpass the days, the months, the weeks, and the years. Sometimes we might go and say, okay, I'm going to join this group for this many weeks and then I'm done. That's not how it works, and neither would you want it to end, right? You're going to want to keep going because it's giving you something. And you're not just getting, after you've been in a program for a period of time, you're also giving. And there's no better feeling than that, right? To be giving back part of what we've been given. So I'm going to talk about two terms here. I think, it's important to talk about both. Some of you may be more familiar with this codependent term. Some of you might be familiar with the newer prodependent term. So I'm going to talk about both. Okay. So the term codependency was popularized back in the late 1980s by two authors. The term itself existed beforehand. These are just the two women who kind of popularized it. And they both wrote books on it. You might have read them. You might have benefited greatly from them. The authors, Melody Beattie and Pia Melody, they have done some amazing work. They have helped a lot of people. And Melody's definition of codependence is, a codependent person is one who has let another person's behavior affect him or her, and who is obsessed with controlling that person's behavior. Okay. So, like I mentioned, they've helped a lot of people. It often shows up as unhealthy patterns in relationships. These may have been patterns that you either saw, experienced, or modeled for you in childhood. Sometimes we see that those patterns continuing, not for desire or wish for it to happen, but maybe it's showing up like, oh my gosh, I'm repeating history. Here we go again. You hear and see the stories of where it's kind of passed down from generation to generation. It could look like rescuing or people pleasing, caring for people in order to help yourself feel better, trying to hold it all together. And it's often a learned behavior. You don't know any different. It's what was shown for you. It's what you've always been involved in. It's the way we show up. Okay. And so whether by verbally saying it or just by patterns or ways in which it was mirrored for you, someone or something showed you like, this is just what you do. So a lot of times you hear the term detach with love connected to codependency. And, and that idea that if you don't do that, neither you nor your loved one is going to be okay. And that can be pretty alarming for a lot of people. I've seen that terminology used a lot, and you can see some people who kind of get the concept, who kind of grapple with it a little bit and kind of come to terms with it. And others, it's like you might as well have told them like the world's worst news, right? And that advice, although I don't think it's completely wrong, I think there's elements in which we do need to detach or disconnect. It can really leave people feeling very confused and misunderstood rather than supported and validated. You know, Essentially what codependency, what the idea is to give you options in your decision making, right? Understanding that your decisions are not just for the well-being of your identified loved one who has this disease. They're also recognizing that you matter too. Is this decision mutually beneficial? And if not, well, we need to make better decisions. And there's no need to be ashamed to recognize, oh my gosh, like I am a codependent, right? There's ways in which this has impacted my life, like past, present, and I hope not for the future. But then when you learn to do differently, you're going to show up differently. And you begin to identify that you're going to stop trying to do what's impossible, and that's controlling other people. And so you start focusing on what is possible, which is like taking good care of ourselves. That's possible. Many of you probably are very familiar with the Serenity Prayer, so I'm not going to share that one with you, but I do want to share you a different version that you may not be as aware of. Maybe some of you have heard it, maybe you haven't. And it is the version that is used in the Adult Children of Alcoholics program, so ACOA. And it says this, it says, God, grant me the serenity to accept the people I cannot change, the courage to change the one I can, and the wisdom to know that one is me. I love that version because it really keeps it away from being like things. It's kind of like, like this ambiguous ideas. It makes it very, very personal. I cannot change the people around me. I can't. I've tried. The only person I can change is me. And when we recognize that we are capable, we are worthy, we are enough, we can do that. And it's almost like our gate gets a little quicker. We kind of like puff up. We're like, oh my gosh, yes, that is it. I can control me. All this other stuff is beyond my control, but I can control my responses, my engagement. I can control my reactions. I can control my self-care. There's a lot of things you can control. When we focus on that and it's personal to us, we're much more likely to do it. So when we talk about the codependency, it's consciously in a way that takes ourselves and others into consideration when making decisions. When we recognize the codependency traits and it's always about somebody else, that's not healthy. But when we use them and us and what's healthy for both of us, there's mutuality, reciprocity. That's when we have a healthy response to codependency.
Kelly?
Love in a way that we think should propel us to that way, and it's not actually helpful. We may love and lose, right? We may love and it may not actually be helpful. You may love and you may hurt, not your intentions, not what you designed to happen. It's not what you anticipate would happen. You never would have done it. But I think it is important to recognize that you can never feel too much love. You can never express too much compassion. You cannot have too much empathy. It is when we think we can do it too much, that's not actually helpful. What we're going to learn is this is what's going to kind of propel us into the next segment about prodependence, is that love, when it's not done in a way that's helpful, it's distorted. And that's what, a lot of those codependent behaviors and reactions, it is not for lack of love, it's because of love. But the way that this disease manifests itself is it's going to distort that. So I'm very curious. I'm not going to, if you have heard this term of prodependence, I would love to hear that. If you just want to pop it in the chat, I'll read it real quick. But prodependence is a newer term, right? A lot, if you've been around the recovery world for any bit of time, you will learn that a lot of language around addiction and recovery, it just kind of evolves. And so this is a psychological term that was created by a gentleman named Dr. Robert Weiss. And he uses term prodependence in regards, it's like a healthy interdependence, okay? And it was described to me this way, and I like this idea, it's like this evolutionary shift, and it provides a solution to codependency, right? It's recognizing that codependency is like the problem, right? We recognize that there's a problem, But a lot of times, people, when they recognize codependency, they don't like it because it's kind of blaming and maybe shaming. It can kind of be judgmental. Like you're thinking, well, I was loving, yeah, but you did this. And it has almost like a negative connotation to it. I think when we fully understand it, it's not necessarily there, but that's often like the knee jerk reaction and a lot of ways in which people look at it. And it's not in such a friendly light, if you will. So this term kind of is like a naturally evolutionary way of looking at it. Actually kind of provides a solution to the concept of codependency. So what its intent is to improve the ways loved ones of addicts or alcoholics are treated. It offers more dignity for their suffering rather than blame for the problem. So recognizing you also have been suffering, right? I like this because it very much parallels the work in which we do with our patients, right? They are not a bad person who needs to get good. They are a sick person who needs to get well. Okay, I think that parallels this very well. It's an attachment focused view. So if you are a attachment theorist, or if you've heard of attachment theory, it kind of follows along that. And it basically says, those who partner with someone who is in active addiction, they're loving people. And they just may have been caught up in circumstances that go beyond their ability to healthfully cope. Like the situations you have been in, they go beyond your ability to cope in a healthy way. So the desire to love the addict is all related toward, they're trying to help. The desire is to help. And it's nothing more than a normal, healthy attempt to remain connected. That desire, like, I don't even care like what they're doing. I just want to know that they're okay, that they're breathing, that they're living, that they're well. And recognizing there are extenuating, difficult, horrific circumstances. Prodependence is choosing to celebrate and value a caregiver's loved ones, their willingness to support and stay connected with an addict and alcoholic while they're going through these crises. But the difference is this, while also promoting healthy interactions and healing for the family, which is we're going to get to. So it really looks at the behaviors and things that are done in response to active substance use disorder as someone's best attempt. You did the best you could with what you had, right? You may look back like, oh my gosh, had I known what I was doing wasn't helpful, I totally would have done it. You're right. But in that moment in time, it's going to be very hard for us to accept, is we did the best we could with what we had at that given time. It sees these behaviors as loving, though often less than ideal. I don't want to hear you just take away like, oh my gosh, everything is fine. No, recognizing that those behaviors were loving, the intent was love, but they're often less than ideal because they didn't actually work. They weren't actually helpful. These behaviors are viewed as problematic because they've been ineffective, right? They don't work. The intent is good. They don't actually work though. And they do have a propensity to propel and exacerbate the situation, even though that was not the intent. The intent was to solve, the intent was to fix, but that wasn't actually what happened. So prodependence really views these actions as the loved one's best effort to stay connected and help in a situation that's far beyond his or her ability to remedy. Okay. So when we look at this, it really gives us this idea that, we don't have the training, right? If we're showing up in a way that's less than, because we don't know. We don't have the specialized education. There's people who are out of control who we love. They have issues with substance use disorder. It also recognizes the immense pain and the fear that comes along with you as a family member seeing your loved one suffering. There is immense pain. There is immense fear and worry and all the other feelings that go along with it. So often when someone is feeling that way, they often try to compensate for the lack of experience or the lack of intellect or understanding. And they have these passionate attempts to love someone. And because they don't have the proper training, they don't understand, it can really be counterproductive. And some of you may have found yourself in a situation like that. Like, I really thought what I was doing was helpful, and now I know it actually wasn't helpful. So what's the goal of prodependence? Prodependent support looks like, okay, validating your love. You are showing up the way you're showing up because you love this person. But while you love them, let's develop some skills that can actually make your love more effective, right? Love just for the sake of love isn't often going to have the outcome. And I think, for an example, like when your child was small, for example, or when you were small, your parents hopefully did this for you too. Like, they loved you enough not to let you touch the hot stove, right? they could have, but no, they wanted to help protect you. But this idea is like being able to help you love more effectively, knowing that, keeping you from doing something might actually be the loving action. So some of the skills might include establishing healthy boundaries, which we're going to get to, self-care, and when useful, detachment. We're not going to say detachment is never the answer. It may be, and we can talk about ways in which we can do that in a healthy way. Taking the path of self-exploration and personal growth, it's going to help you as a person and help you be a better member in your family, in your partnership, in society. So sometimes the things that bring us into a position of needing this like external support, whether, substance use related or not, if we grow, it's going to compound into other areas of our life. So codependence essentially seeks to validate, support, celebrate, and show love for valiant effort, and empathize that you have not been able to achieve your goal, and show them how to love better in a way that is helpful as opposed to not helpful. Okay, that was A for effort. That's not actually helpful. Let's do this loving thing instead. So, I saw that a couple of you may have heard of it. Someone said, I guess just one that said, when your husband was a Caron, you got some information about that. So, you can find more information. If you just look at prodependence.com, it is a newer concept, but I think you can maybe, especially if you have a history of working in a codependent type framework, this is just a nice add-on to that. And if the codependency work you've been doing works for you, we're not saying you have to switch and do it this way, just giving you an opportunity to look at it from a different perspective. And this may be super helpful for you if you are one who has been talked about codependency and it's not sat well with you. So I'm going to put that out there, and here's some examples of kind of how they kind of parallel each other and how like the difference of them. So codependency might say, I hold the family together, it's my responsibility. Prodependency says we all have specific roles in the family and we work together to meet those needs or those goals. Codependency might say it's my job to make sure that everyone comes to family dinner. Prodependency says, I'm going to go to dinner. It's up to them if they join. I'd really like if they did, but it's up to them, right? Codependency might say, I don't know if he can get up in time for work. Prodependency says he is capable of setting an alarm clock. He's capable. So, codependency says, let me do this for you. Prodependency says you are capable. So I like that kind of side by side because it just gives us a little bit of a differing approach and maybe a more helpful way of looking at what we're up against. So as we go into how can we help? That's the $1 million question, right? If I could tell you 10 crazy things to do right now that would offer help to your loved one, you would do the 10 crazy things. You might even do 100 crazy things, right? But we're going to look at understanding the 3 C's, assessing your contribution, looking at the aid rules, and then developing healthy boundaries. All right. If you've been a part of Al-Anon or any kind of 12-step family programs, it's likely you've heard these, right? I did not cause this. I did not cause the disease of substance use disorder. You are not that powerful, right? You may have had thoughts or feelings about that, but you did not cause substance use disorder. You cannot control it. Many, if not all of you, have tried in some way to control substance use disorder. You haven't been successful in doing so. You cannot cure it, right? Thankfully, as a side note to that, it's not curable, but it is a treatable condition, thank goodness, right? There is a path that has been laid out and has helped many, 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 many people find a way and treat their condition of substance use disorder. The 4C, so this is one that we can look at. We can look at our contribution. There may have been ways in which we have contributed to this disease. And once we know about our contributions, we become aware of them, we then can stop doing them. We now know differently, so we can show up differently. Looking at your contributions to the crisis can often feel very shameful and uncomfortable, like, oh my gosh, like I didn't know. Or maybe I did know, but I didn't know how to stop. I didn't know what other options they were. I felt like I was helping, whatever it might have been. Remembering, and this is again kind of going back to like those pro-dependent terms, you were doing the best you could with what you had at that time, given a difficult situation. Someone you loved was not safe from harm. We do need to assess the ways our behaviors have contributed to the crises, acknowledge them, take responsibility for them, and make the choice to not do them any longer, right? Even if they made you feel good. Some of those enabling behaviors, for example, they have alleviated some of your fear and your anxiety. But now that you know that it's actually a contributing factor, well, then you can make a different choice to not do the same things, okay? So often the framework that sometimes we're given when we're being told like don't do this, don't do this, don't do this, you're like, yeah, that's not very helpful. Okay, what do I do instead? So I'm glad you asked because these are things that you can do instead, right? So these are some acrostics that were created by one of my colleagues, Sarah Martinez, and some of you may have gotten to know her over the years. But using this terminology, these aid rules, how can you help? Allow, inspire, demonstrate, refer, untie, love, embrace, and self-care. So I'll go through these one by one. So allow for natural consequences in learning. Let them have the opportunity to learn from what's going on around them. Don't take that experience away from them. Okay, allow for it. Stop protecting. It seems like it may be the right thing to do. It may feel good. It may seem like the parental, the familial thing to do. But stop protecting. Stop shielding. Stop bailing them out, and stop lying for. Right. So especially as many of these things, if not all of them, go against your own morals and values. Allow for natural consequences and learning to take place. Inspire. Send the message. You are capable. You have the tools. I know you can do it. You have what it takes. I believe in you, whatever it may be. And you might be thinking to yourself, like, I don't know if that's really true. Say it anyways, because they do. They have what it takes. They know what they need to do. It's a matter of doing it. And if you're in that position, you're saying the words, you're like, I don't know if I really believe it. Find yourself in a meeting and go get some support for that, right? But they need to know that they are capable. If we take on things for their own selves, it actually creates the opposite message. Like, I don't believe you're capable. I don't believe you can do it. I don't think you can. And so you can encourage, be fully present, and share in their pain. Try not to take away don't take away the pain from them. Let them be sad, let them be hurt, let them be frustrated, but sit with them and be with them in their pain without trying to take it away. Have compassion. What you're going through is very difficult. A lot of people don't have what it takes, but I know you do. You're one of the winners. You're a warrior, whatever it is, that empowering language. Be positive. They're going to rise to the occasion. They are capable. And the more, and they can borrow your belief until they have it on their own. They can borrow your belief for a period of time. Demonstrate. Go to your own meetings. Go to your own support group. Show them what recovery looks like. There are now even more so since the pandemic, resources such as this and online meetings, and any time of the day you can find a meeting. Go to your own meetings. Talk about what you're learning. Not be preachy about it, not lecture about it, but just like say, hey, and they're going to see that you're showing up. Every Thursday night, I go to this meeting. I do this on Saturday mornings, whatever it might be. Talk about your feelings. I'm not going to say in every conversation all the time and in every which way, but have emotionally intelligent conversations. I'm feeling this way and I'm taking care of myself by doing this. I'm still worried, but I'm managing my anxiety by talking with my therapist, whatever it might be. Develop and use healthy coping skills. Getting a list of great ideas from like a seminar or a counseling session or reading a book or listening to a podcast, they're great, but they're not going to be effective unless you actually implement and do the things they're telling you to do, right? Get your own support. It's that idea of putting your own oxygen mask on first, right? You're on that airplane. They say if you're traveling with a small child or someone, with a disability or whatever it might be, put your own oxygen mask on first. And it may be like, oh, no, take care of them. If you can't breathe and they're incapacitated, you can't take care of them because you're also incapacitated, right? Put your own oxygen mask on first. That's what you're going to do by getting your own support. Refer. Ask professionals or other people who've been through this experience. Don't talk to your mother, your sister, your neighbor, your colleague, your hairdresser about this unless they understand. And even if they do, talk to professionals, other people who are going through the experience like right now. Maybe people who are a little bit more objective, can be neutral and can guide you in that way. Listen to the books, listen to the podcasts. We have a lot of resources on our website, for example. But this is my caution with that. Reading the books is great. Listening to the podcast is great. But unless you're implementing what they're telling you to do, you're not going to get the outcomes that they're talking about. If we want what they have, we have to be willing to do what they've done. And that's the hard part, right? We would love to be like, there's a quote that says something along the lines like, don't compare your chapter 1 to my chapter 10. Right? If I'm sharing my chapter 10, you're like, okay, I want that. You need to realize that how to go through chapters 1 through 9 to get to that chapter 10. Okay. Get educated. You guys are clearly doing that now. My guess is many of you have done other than just this one. Get that education. And then also share that with others. And by sharing with others, you also reinforce what you're learning and do something with it. Okay. Untie. Be the focus of your own emotional well-being. Focus on you, using that version of the Serenity Prayer. Okay, be your own focus. If you are well, if you are in a healthier position, even if nothing around you changes, you will be in a better position. Okay, you'll be responsive versus reaction. You'll be able to focus on the things you can control, learn to let go of the rest. And it's not going to happen overnight, but the more you focus on your own self, you gain that independence and you focus on your own core values and your own beliefs, you will be in a much different position, even if nothing else in your life changes. So love without trying to fix or heal your loved one. Love for the sake of love. And you can love without liking the things that they do, right? There is a way to separate the two. You love your loved one at their core, their essence, their true self. You don't have to love what they're doing. You don't have to love the whole package, if you will, especially if they're doing things that are destructive to themselves or to other people. Being willing to learn how to ask for what you need. Embrace that this is your reality. This is not the reality you set out for. This is not the one you asked for. This is not the one that you wish upon you, yourself, and your family. No, but acceptance. When we begin to accept the things that are a part of our reality, we can then begin to move in a positive direction. Embracing the 3 C's. You did not cause this. You cannot control this, and you cannot cure this. So the last one is self-care. Practice physical, mental, emotional, spiritual, and social self-care, right? Self-care is not selfish. Sometimes I think because that word self is in there, maybe we get this idea like it's selfish. No, it is the greatest act of love you can give yourself, and recognizing it is counterintuitive, right? It is okay to start small. It's not only okay to start small, it's the only way to start. You're not going to do these grand gestures, these big overtures, these huge things. Start small. Waking up a little bit earlier in the morning and watching the sunrise, or, having a few minutes of alone time, or, drinking your coffee when it's hot before the rest of the household is awake. Maybe it's, planning a yoga class for once or twice a week. It could be, going to therapy. It could be doing a lot of different things, but put your own oxygen mask on first and practicing healthy boundaries. I'm seeing a couple of comments come through, realizing it is difficult to show love when I'm hurting, right? And when you begin to show love first to yourself, which is often counterintuitive, you are going to show up in a different way. And you could even have like a saying like, I love you, but I don't like what you're doing. Right. Yeah. Okay. So it is difficult to express what I need when he is not capable. How do you deal with that after decades? Okay. Great question. So if a person is in active substance use disorder, they are not capable of giving you what you're expecting. The reciprocity in a relationship, in a mutual relationship, or to be able to have like healthy conversations is not possible. And unless that person also does their own experience of healing, it's not going to be, okay? Yeah, sober but not emotionally there yet. There's a lot of healing that needs to take place. So consider your source. He does not need to be the only person who gives you that love, care, acceptance, positive regard. Very often, there's other people in our lives that fill that gap. And let's be honest, those people are very often in these circles like you are in tonight, in Al-Anon and Nar-Anon and Families Anonymous and whatever support group you have found. Those people filling the gap, reminding you, you are worthy, you are capable, you are enough. You did the best you could with what you had, whatever that empowerment, that love, like kind of standing in the gap and knowing that you as a person, when you were doing your own work, you don't need somebody else to validate you. You don't need someone else to step in and fill that gap because you are filled up. Right now, you're depleted, right? But consider your source. If you're going to a source that has continually not met your expectation, don't keep going back to it. Find a different source. And I'm not saying like find a different person, find a different partnership. That's not what I'm saying at all. It's like you have inside of you something that's going to fill that. You've been depleted. So what's the answer? Self-care. Do the things that are going to fill your cup. And when your cup is filled up, these sorts of things are going to be much easier, but it's going to take time to fill your cup. So that brings us to healthy boundaries, okay? So boundaries is often a loaded question. I'm mindful of the time as well. So I'm going to go through this and kind of give you this framework because I want to make sure we leave questions at the end. This is not a black and white thing. I wish, oh man, do I wish I could say, this is what you do, this is what you don't do. It is very much going to be a personal situation. However, I do believe that the framework we have kind of put together may be different than what you have heard already, unless you've been around our services for a period of time. So what are boundaries? Personal boundaries are physical and or emotional limits that are set for themselves to safeguard your overall well-being. So these are things that you set for yourself to protect yourself, okay? Healthy boundaries help define who they are and to ensure that relationships are safe, supportive, and respectful, okay? Unhealthy boundaries are thoughts or behaviors used to manipulate or control relationships or keep people away. That may have been the framework you kind of entered into this work, or you maybe came in this evening thinking, oh, I thought boundaries were about changing the other person. No, it's not possible. If it were possible, I'll give you ones all day long. It's just not how it works, right? And those of you who have tried that can reiterate, it's not what works. It's not actually helpful. So we're staying away from things that you do, like, okay, if you don't do this, and I'm going to do this. Those are threats. Those are often not even followed through upon, and they don't really work. They're not effective. Okay. So what does work? When you tie your boundaries to your core values, you are actually going to be more likely to follow through on them, because it's not about the other person. It's about you and your values, the things that are important to you. And this may take a little bit of digging, because some of you may have been like, I don't even know like what this is like anymore. I don't even know what's even going on, right? Determine what you need to protect your core values and develop a way to honor that need. Okay, so once you identify your core values, and I'll give you some examples. Once you know what those are, protecting them, honoring in a way that you can protect those. Okay, it is okay to start with small boundaries and work up to larger boundaries. In fact, I think that's the only way to do it. And when we set a boundary out of fear of anger, we rarely uphold them, because those feelings are fleeting. Maybe you're not feeling angry anymore. You're not as scared. Things have kind of calmed down. And if that's the case, you're not very likely to follow through on those things anyways. Don't set boundaries in a crisis situation. I'll give you some examples. Like they aren't going to be effective. So what are core values? Great question, right? Core values are your fundamental beliefs. They are the guiding principles that dictate your behaviors and help you determine right from wrong. They might include honesty, integrity, health, kindness, safety, family, things along those lines. So if you value honesty, I'm gonna walk you through this real quick. So if you value honesty, so you see across the top there, okay. If I value honesty, so I need to tell the truth. And I'm gonna honor that by not lying for my loved one. I'm not gonna do it anymore. It goes against my values, and I can't sit with that anymore. I'm choosing not to do that anymore, okay? If I value kindness, so I need to have a space that if I feel angry or upset, that I can process my feelings before I express them. And I'm going to honor that by asking for space or remove myself from a situation when I feel that I can no longer be kind. Side note, many of these boundaries that you're going to come up with will be helpful to have a conversation about them prior to being in the moment, okay? So you may have some of these conversations ahead of time, especially when someone's like in a clearer state of mind. Like, look, I really value kindness. And when we get in these arguments and I can't be kind, I'm going to choose to step away, because I don't want to say things I'm going to regret. I don't want to act in a way that goes against my values. And so I want you to know I'm going to take care of myself by stepping away. So if that were to occur, don't be surprised that I'm going to exit myself. That can be helpful. I value safety. And so I need a substance-free home. And I'm going to honor that by removing substances and ask people to leave my home if they're using. And what I can appreciate about that is, like, you're not saying you're not allowed to use, don't ever use again, whatever. You don't have control over that, unfortunately. However, if you choose to use substances, you're not welcome in my home, because my safe place is my home. I value safety, and substances, they're not safe for me. Okay. You can see how that's different than be like, you're not allowed to use, don't ever, This is about you. This is about you and your safety and your safe space, which is your home. Okay. More examples. We need lots of examples, because it's like, especially if this is new to you, you're like, I don't even know what this looks like. Okay. Empathy. Let's say you value empathy. So you need some space and time to recharge so that you can be empathetic towards other people. So some examples might be, I'm going to develop and adhere to a bedtime routine. It includes turning my phone off at a certain time so that I can recharge. I'm going to take off 1 week from work in the summer to go to the beach and with my family to recharge. I will attend 1 yoga class per week and turn off my phone during this time, and not being willing to basically move that, because if I go to yoga, it recharges me. I'm able to show up in an empathetic way, and that's my value. So these are ways in which you're protecting your value of empathy. Let's say your value is peace, maybe like peace, calm, serenity, something along those lines. If you need peace, a need might be, I'm have a routine in order to maintain my sense of peace. So when I'm in my routine, I'm able to kind of keep that sense of peace, calm, serenity. And so I'm going to develop a daily routine and include the time I'm available to help other people. And I'm not going to break from this routine to help other people. Obviously, emergencies, things like that, sure. But like, if we're going to go by this. This is what I need to protect that peace and serenity in my life. I'm going to have my morning coffee before engaging in work or intense conversations, right? Peace is important to me. Without the caffeine, I'm not really in a peaceful state. I will use my weekends or time off to engage in hobbies and things that I enjoy. Those things all point back to having that sense of peace, calm, and serenity, which is a value. All right. So boundaries can come on a continuum. Where we are aiming is that middle piece, right? That just right. You can look at the far left, too intrusive. These are probably what most people are pretty familiar with, is like this attempt to control another person. They're often used to be cruel, to punish. They build resentment, both sides, because one, the person on the receiving end is like, who do you think you are? That's not possible, whatever it is. And you're going to have resentment because they're not going to hold to them, right? They're not realistic. They're not effective. On the far right, these two distance, it sacrifices your own values. You're allowing another person to have control over you in some way. It also builds resentment, and it's also not effective. So where are we going to focus? This middle place, just right, being self-focused, enforceable, and practical. It really allows the boundary setter to uphold their values. That's what this is all about. If you can protect your values and that's your framework, that's your grounding principle, you'll be in a much better position. So there are some examples of some boundaries that are too intrusive. And intrusive meaning that they kind of go against, what you typically would do. So you might say things, these are not attached to core value. They are attached to a feeling, which is often one of overwhelm, maybe fear, disgust, despair. Often fear is the underpinning emotion. But you might find yourself saying things like, you can never come back in this house again. I'm never speaking to you again. In that moment, you might think that, you might feel that, you might want that to be true. When things calm down, you're not going to follow through on that, right? So let's look at these a little bit different. I really value safety, and I do not feel safe when you are using in my home. If you need to use, you cannot do it here. I really value respect, and right now I don't feel like either of us are able to be respectful. Let's come back to this later. Those are some ideas. There are some examples of ones that are too distant. There's statements that sacrifice core values. I don't care anymore. Do what you want. Sure, whatever. Looking at those a little bit different. You might say something like, I feel like my values being sacrificed here. Can we find a compromise? Is there something we can do that's mutually agreeable? I don't feel comfortable with that. Let's find a solution. Do you have any ideas? Like something we can do to kind of meet in the middle, like help them have a part of the opportunity. This is possible in sobriety and recovery. If you're trying these conversations with someone who is under the influence, it's not going to work. But I'm going to put this out there. Often boundaries, you are saying them because they're about you. Remember, they are about you. You're basically saying, these are the things I'm no longer willing to tolerate. These are things that are no longer safe for me. These are things I'm no longer willing to engage in. And so I'm going to protect myself, like this white fence around me. I need to protect myself. And so you may be saying it just for the sake of protecting yourself. He or she may not be willing to listen, but you are standing up for your own self. So some quick tips for setting healthy boundaries. Use I statements. You may have heard that before. Remember that boundaries are for and about you. They are not about your loved one. They may affect your loved one depending on his or her behavior, but they're not actually about your loved one. And they're not meant to elicit change. They may precipitate a change. They may have an effect on, but their design isn't meant to change the other person. It's to protect you. So ensure that the boundary is enforceable and practical. You might have these like grand arching ideas that might sound well, but if you can't really enforce it or you can't really do something about it, it's probably not the best one to put out there. That's why sometimes it's easy to start small and kind of build upon it. Do not sacrifice your own values for someone else. Especially if you identify in the codependent realm, you may have found that you have been doing that for a long period of time. And it's not going to switch overnight, but you'll be more likely to be able to do that once you have this new framework. Say what you mean what you say, just don't say it in a mean way, right? We can say things in a different way that's more hearable, that's more, readily received. And sometimes we need to work on that. So get comfortable with being uncomfortable. It doesn't always feel good to set boundaries because it's counterintuitive. What you've been doing thus far is likely been the more intuitive response. And what you may hopefully have learned is like, that's not the way that's going to really have any healthy effect on your loved one, which is your intent, is to help them, and it's harming you. So get your support, right? Al-Anon, Families Anonymous, Nar-Anon, Codependency Anonymous, Caron Family and Support Meetings. There's other recovery programs that also have family components. Honestly, it doesn't matter what you do something. And whatever they tell you to do all the things. There's sometimes people who like pick a little bit of this, a little bit of this, a little bit of this. It's not going to work, right? Whatever program you pick, do all the things. Do what they're telling you to do. Often people say, well, I tried Al-Anon, it didn't work. And when further prompted, well, did you do what they tell you to do? Did you go through the books? Did you get a sponsor? Like, well, no. Well, you can't expect to have the outcome of what other people have gotten when they've done the work and you haven't done the work. Okay. Books, resources, education. Again, all those things are great unless you don't implement them. If you don't implement what you're learning, they're going to have no effect on you. Okay. And do it little by little, day by day. Consistency trumps intensity. If you like these grand gestures of doing these good things, but you don't do it consistently, it's not going to have a very much bearing on you or your loved one. Self-care, physically, emotionally, mentally, spiritually, socially, your relationships, setting boundaries to make sure you don't get back in these crisis situations. Okay. Detaching. There may be times for your own sanity, your own well-being, and for the wellness of your loved one that you may detach, for a period of time or in certain ways. Knowing that your well-being is not contingent upon your loved one's well-being. You can get well even if they choose to stay sick, okay? Hopefully, you'll both be on the same pathway towards health and wellness, but you can get well even if they choose differently. So what have we learned? Every person in a family system is affected by substance use disorder. That's why we call it a family disease, okay? It is absolutely, positively okay. Give yourself permission. Get the permission from us if you can't take it for yourself, to focus on your values, your beliefs, and your needs. Setting boundaries is not an easy situation, but it is an important one. And especially given the framework that it's about you, that seems a little bit more reasonable. It seems a little bit more feasible because it's a little bit more enforceable. This is about me. This isn't about you. It may affect you, but it's not about you. And there is always hope. So with that, I'm going to give you guys an opportunity to open up with questions. If you want to type it out, feel free. If you want to put something in the chat, also feel free to do that. Recommend any specific books or resources? Corey, I can send you a list that we send out to a lot of our family education participants, if that might be helpful. There's different things on there. Like there's meetings, there's podcasts, there's some resources that might be helpful. So I can make sure Corey gets that. Any other questions? Feel free to take yourself off mute if that's more helpful.
How do you know it's time to let your family member come home after they've been in sober living? Like, when do you know they should come home?
That's a great question.
Let's say a stay or to go back.
That's a great question. I would say defer to the people who are working with them. Whether it's a sober support or a coach or whoever's working in that sober living. If they feel like it's an appropriate time, then defer to them. It's okay to tell your loved one, well, let's talk to your therapist about that. Let's talk to your house manager about that. Defer to people who would give you that stamp of approval, if you will. And I trust that if they are in a sober living, that there's going to be some parameters provided to make sure you guys are on the same page before that thing were to happen. And also recognize that it's okay if the answer is, I'm not ready. That's like a boundary, right? I'm not ready. You might be ready. They may say you're ready. I'm not ready. Or, that's maybe where you come to like a compromise. Maybe you can't come home. My home is my safe space. I'm not ready for that. Maybe we'll meet halfway. We'll stay at a hotel for a night, something along those lines. There might be a way to kind of compromise, it kind of go in the middle.
Okay.
So I see the question, do we try and push our 20-year-old to go to sober living after residential? I would say, again, like defer to the professionals. If the professionals are recommending for that to happen, then yeah. And you may even say along the same things what I said to this other lady is like, you may be ready to come home. I'm not ready. I need some space. I need some time to heal. And right now, you being back in the mix, this is not about you. This is about me. I'm not ready, and almost like protecting that investment they made in residential treatment. You go to residential treatment, you did so much work, continue that work, and then you really get that opportunity to really try out recovery before you are it kind of transitions you back into real life. But recognizing, defer to the treatment team. The treatment team has made a recommendation for a reason, going over the criterion why that was recommended, and that might be a helpful way to go. Use that third party differential, can be really helpful. Yeah, what do you do if things have been going on so long that you are just numb? I don't react anymore. Yeah, you and your body, your brain have been protecting you for a long time. My heart goes out to you, and that's a painful experience. And to say you need people to love you, right? You're recognizing, I cannot control my loved one. I've been doing this for so long, I can't even feel. The time is to focus on you. You are worthy of love. You are capable of more than you know. And there is welcoming arms, whether virtual or in person, out there waiting to love you back into a place of health and wellness. And that is completely possible, even if your loved one doesn't gain that same health and wellness. I don't envision many more healthy or happy or blessed communities than the ones that are found in a 12-step community or ones that are similar to.
So while we're waiting to see if there's any other questions, and please feel free to add them to the chat. I am going to put the link in for the Survey Monkey so that you can definitely let us know what we can do to improve and what other topics you're interested in hearing about, so that we can continue to offer these. I do think somebody asked, will there be another one? So these are coming out every month. We've been trying to have a session that's on some sort of topic relevant for families. The next one is set for October. I'm sorry, I don't have that date right in front of me, but it's on triggers, feelings, and behaviors. And if you haven't gotten the communication from us, the email about that, please let me know. Tomorrow I'll be sending out the recording of this and any resources that Kelly provides for us. So I can also attach information about our next session to that. And it looks like Kate said, what is your email to send mine for info? If you registered for tonight, I don't know if you're asking that for me or for Kelly. But Kelly, I attached her to the reminder email that I sent out in advance. So you should have her email and mine as well. But I'll also add to the chat here. And I think and the presentation and the slides will be available afterwards through our YouTube channel, but I usually send the link directly to that. If there aren't any other emails, I just want to thank Kelly, for doing this for us tonight. I really loved hearing the information about the codependence and the healthy boundaries for sure, because that's so challenging for all of us and something we have to practice on an ongoing basis. So thank you, Kelly, for being here with us tonight.
Mhm.
And thank you all for joining us. And then until next time, have a great evening.
Thank you all.
Did I ask her to put it up there again? I can still ask her. Excuse me. Hello, could you please put the link up to give feedback again? I'm sorry, I didn't get it.
Sure. Let me do
Thank
that.
you.
Let me do that right now. It's just taking me a second.
There's her email.
Here it comes. I'll also include this in the email I send tomorrow night too, but it'd be great if you could do it tonight. Thank you.
Thank you.
Sure.
I keep hearing that Caron has alumni of Caron get-togethers, but I haven't been able to find any of them for my son who's in Boca, and where he can go and like meet up. He did go to Caron one time and he met up and they were going to put him on that he would actually help somebody else at the residential thing. In which case his therapist said, "No way. You are not qualified to do that yet at all."
Right.
So he was told not to do that. You're just in the beginning of your recovery. But I keep hearing from other people that they have, I don't know, like social events to go to where they can meet other people. Is that true or not true?
So Kelly, I don't know if you know the answer to this. I'm not as familiar with what the alumni group is doing in Florida, but I can get that information and I'll make sure to connect you. My counterpart who oversees the alumni services, I can make sure that the two of you are connected and she can provide any information about Florida and what they're doing through the groups there. But there definitely are alumni support services. So if he's not part of that yet, we want to make sure that he is connected.
Right. Okay.
So I took your name and I'll follow up with you tomorrow about that.
Okay. Thank you.
Sure.
If it's not under my name, the email, it came to my husband, Ray Glemser. Same
Okay.
person.
All right. I'll write you both down. Thank you for reaching out and asking.
That was a good session.
Thank you.
I do like some of the podcasts. I don't read a whole lot because so many of it's so sad, the endings. And I don't want a sad ending. So I can do only so much. Then I have to say, okay, well, this is a little much.
Right. Because you need to be able to, there has to be hope, right?
Right.
Yeah.
Right. Good. Well, thank you very much.
You're welcome. Thank you for joining us.
Hi.
Hello.
This is Kate. I've been asking questions. This was very timely for me. I really appreciate this program, and somebody from Caron had sent me the link. So I'm not sure if I'm on the list or not.
Okay.
That works exactly, but I'll send you my email tomorrow. But I filled out the survey, and the one question I had is, maybe something more, or maybe are there podcasts? Are you talking about podcasts that are on the actual Caron website? Because I'm looking for information at this time, like a year after recovery, after being 1 year after being at Caron, and just it's a different stage right now.
So I think there's a variety of different podcasts out there. Caron does have a parent to parent podcast that I know is helpful. I don't know if you're a parent or a spouse or
I'm a spouse.
a spouse. So that one's probably less relevant. But let me look again also to see, and I can include that you do have my email now. So I want to take a look at some of the resources that Kelly was talking about. She might have some additional resources. I think she disconnected from she was on twice with her phone and her computer. So I think she disconnected. So I'll have to get back to you on what might be out there for spouses. I don't think that we have anything specific, any sort of podcast that's specific to spouses, but we do occasionally put some things out there that are specific. So I want to make sure that you're included in any kind of communication, especially if you didn't get it directly and you got it from a friend. So we'll add your email if you want, and then also, I'll send you some resources.
Okay, that would be great.
Sure.
Thank you. I just put my audio on. I can't see you now. I'm the only one on here. I don't know what happened. I guess it's pretty much over, but
yeah.
You can see me now.
Yes, I can see you.
Okay, I can't see anybody else but me. I don't know what happened. But okay, great. Well, I'll send you your oh, Corey. So is it C Trevina at Caron.org?
Yeah.
Okay, I'll just send you a quick email now with my email then.
Perfect.
All right. Thanks again.
All right. Really thank you.
Your time. All right. Good night.
Good night.
Bye.